Emma Soy, the founder and owner of Gentle Shepherd Care. We are a nurse-directed elder care company here in Charlotte. So thank you for joining me for our Going Home and Staying Home series. Whether you are preparing for loved ones to be discharged or recently been discharged from the hospital or recently brought someone home with you from the hospital or rehab, and you are feeling overwhelmed, or you're just planning ahead because they are currently in the hospital and you are thinking ahead, you are in the right place. Here's what I want you to know right from the start. Coming home after a hospital or rehab stay is one of the most vulnerable transitions a family will face. And you don't have to figure it out alone. In the next 30 minutes or so, I'm going to walk you through what this transition really looks like and what can go wrong, and most importantly, what you can do to set your loved one up for success. Then, if you have any questions after that, you can always send it to us or reach out to us in any way that we can help. I call the first 30 days after someone has been discharged from the hospital danger zone. Let me share something with you that most families don't know, and they don't know it until it's too late. I'm going to share with you some statistics, and those statistics are very sobering. Number one, nearly 1 out of 5 Medicare patients are readmitted to the hospital within 30 days after discharge. What does that mean? 1 out of 5 older adults who's been in the hospital after 30 days get readmitted. Number 2 statistic, falls are the leading cause of injury-related death for adults over 65. I'm going to repeat that. Falls are the leading cause of injury-related death for adults over 65. Number 3, 40% of medication errors happen during care transition, meaning during the time the person gets discharged from hospital or from rehab and going home and at home. Here's the last one. Most families receive less than 15 minutes of discharge instructions when they are bringing somebody home. Most families receive less than 15 minutes of discharge education or instructions. And sometimes, even during those 15 minutes, can be very overwhelming, and families are not really listening. It's very, a lot of things are going on. It's very hard to listen to all the instructions the last 15 minutes when that person is going home. I've been a nurse for over 35 years. I have worked in major health systems. I've worked as a discharge planner, geriatric care manager, even direct patient care. And here's what I've seen over and over and over again. Here it is. The hospital gets you stable. The rehabilitation helps you regain function. But nobody, and I say nobody, prepares you for what happens when you walk through your own front door. Your loved one comes home and suddenly physical therapy is not the same. They're not there as often as they used to be and when they were in the hospital or in the rehab. There was no nurse checking vitals every shift. The medication schedule seemed very manageable while the person was in the hospital or in rehab. Now it feels very overwhelming. Your mom is scared to walk to the bathroom alone. Your dad is not eating because nobody's there to encourage him during the time when he needs to eat. This is the gap that we feel, and this is the gap that we feel to keep people from going back within the 30 days, going back to the hospital. Here's what also we realize. The first 72 hours after discharge is the most important time. It really matters. And I'm going to walk you through what really happened during the first 3 days. Let me paint a picture for you of what those first 3 days at home often look like. Because if you're living this right now, I want you to know you're not alone. And I understand and I know those are the things. And even if you're not there yet, let me tell you that's how it's going to go. That's how it's always been. I've been in this business for a long time. I've seen it over and over again. Number one, day one, there was relief. Finally, mom is home. And mom is happy because she wants to come home. But she's exhausted from the transition. She's exhausted because most older adults, after they've had a hospital stay, they never go back. 85% of them never go back to the original state that they were when they went to the hospital. So she's home, but she's exhausted. She may not want to eat. She might be even disoriented, even in her own home. The medication list from discharge doesn't kind of quietly match what's in the medicine cabinet. And so you're looking at, does she have this? Does she have that? Do you have a prescription? You're not sure which doctor to call about what. That's day one. Day two really sets in. You realize your mom needs help even getting to the bathroom. And you didn't realize that because all of these things were being taken care of, whether she was in the rehab or in the hospital. And that's what's happening. And that might be happening multiple times, even multiple times throughout the night. You're looking at medication labels and you are wondering what does 8 a.m. means. Does 8 a.m. means with breakfast or before breakfast? Does she take this with meals and with no meals? The equipment from the hospital said they will be delivering it's not delivered yet. And so you're going through that, and that could be very exhausting. Day three, the fatigue is mounting for everyone, for you and for your loved one. Your loved one may be in more pain than expected, more confused than expected. You are Googling symptoms at 2 a.m. You are wondering, is this normal? Should I call someone? Did we make a mistake bringing them home? Here's what I need you to know and understand. This is completely normal. This happens all the time. But it doesn't have to be this hard, really. And this is the gap that we want to be able to help fill for families when they are taking somebody home. What's going home and staying home really requires? What does it really requires? There are 5 essential elements to a successful transition. If you miss any one of them, you are at risk for readmission, false or decline. Let me repeat that. There are 5 essential elements to a successful transition at home. That's why I said the first 30 days are so important. If you miss any of them, that person you can find yourself back in the hospital. And the more someone keep going back and forth to the hospital, you will see decline mentally, physically, emotionally, in every part. And if you are in the midst of that, I bet you can relate to what I'm saying. Number one, the medication management. This isn't just about remembering to take pills. It's not about, remember, does she take this pill, this color, this color. It's about understanding what each medication does and why it matters. Knowing which medication interact with each other or with food. Watching for side effects. Do they get dizzy when they take this pill? Do they get confused? Does it affect their appetite? Now, those are the kind of things, having a system that actually worked for your mom or your dad's daily routine is important. And so, number one, medication management. And so, this is the gap that we oversee. This is a gap that we see. This is the thing that we notice that most families don't have covered. They don't know how to cover that. And so what we do, we come in, we review all the medications. We set up a system and we watch for red flags that family members might miss. And so we help you to identify these things so that we can catch them ahead of time so they're not happening. Okay, so number one is medication management. Number two is the mobility and fall prevention. Remember, I told you that fall is number one reason injury, death related among older adults over 65, falls, injuries that would cause death. So mobility and fall prevention. Your loved one may have been walking in the hospital or in rehab. Well, I'm not going to say hospital, but most of the time they don't even want to walk them. They don't want them to get out of bed. You go to the hospital, put the sidewalls up because we don't want them to fall. And so they're not walking as they used to. So in rehab, they only walk when they go to therapy. So they walk. They may seem to be walking with the therapist, but remember the facility has wide, clear hallway. Home is different. At home, the the hallways are different. They're smaller. There are rugs all over the house. The door thresholds are different. You have pads, you have clutter, and you have a different type of lighting. And so those are the kind of things that we see, and we provide that hands-on mobility support. And so we already know that's an issue. We kind of tied up to, we connect that to our plan of care to help establish safe routines. And so we can identify hazards in the home. We're not just spotting them, but we are building, we identify the problem, what it is, and so we can build more confidence so the person can feel more confidence getting out of bed, going to the bathroom, and things like that. So it's important. So number one is medication management. Number two, it's the mobility. Number three, we look at nutrition and hydration. Hydration is one of the most common reasons an older adults end up back in the emergency room after hospitalization. Dehydration, I'm going to repeat that again, is one of the most common reasons why an older person end up in the emergency room after being hospitalized. Because appetite often drops, okay, during this whole process. If they live alone, cooking feels impossible. And families, well-meaning also, may not realize that a few sips of water is just not enough. And what we do with that is we put that in our plan of care. We know that in advance. We know these things. We know these are things that are essential. And so we make it part of our plan of care to actively encouraging at meal times and preparing simple foods, tracking intakes, and watching for warning signs. We watching for warning signs such as appetite. Are they eating? What are they eating? Are they drinking? How much are they drinking? We track those things to make sure. We're just not thinking, oh, they sipping water all day long or whatever. No, we actually encourage, or we have our caregivers. That's part of our care plan to make sure that hydration is something that is being managed and being taken care of. Number four is the personal care with dignity. This is the part many families struggle with the most. Most parents may not want you helping them with bathing. I've seen that over and over again. For example, if you are the female caregiver, your father may not want you to provide personal care, or you may not feel comfortable provide personal care. If you are the male caregiver or the son, you may not feel comfortable providing personal care to your mother. They may feel embarrassed and they will resist. They will say, I got it. I could do it. I got it. I could do it. Why? Just think about it. It's dignity. And dignity matters enormously. And so what we do, knowing that, we come in with a therapeutic personal care mindset, meaning that we know respect, autonomy is important. So maintain dignity. So that's not only we teach our caregivers to approach personal care that way. And so that is why you will see mom and dad more open to the caregiver to help them with something personal because they're coming in with that mindset, knowing that respect, they respect their autonomy. What does that mean? Usually I'll tell my caregivers, and my caregiver will do it, do for that person what they cannot do. As much as they can do for themselves, let them do it. You might give them direction, meaning that you might want to take the washcloth and you put soap in it for them and you give it to them to wash the important parts of their bodies. You were there to supervise that it's being done, but then they're actually doing it. So it's not you doing that as much as possible. The parts that they cannot reach, their feet, their back, those areas that they cannot reach, you do it. You actually could do it for them, but you don't do these things for them because that is, help them to maintain dignity and respect and give them autonomy over themselves as much as possible. And that actually helps with the healing process. While we're doing that, we're doing more than just watching. My instructions to my caregivers is, you take somebody's clothes off, you're doing an assessment. You're looking at bruises. You're looking at skin, the integrity of the skin. Older adults, their skin are very thin. And so they can bruise easily and they can have skin tears. So you keeping track of that. If they're laying down a lot, they're sitting down a lot, you're looking at areas where they are prone for skin breakdown. So the positioning is very important and providing that gentle support that they need. See all the things that we do when we're doing these things, because we're coming in with that therapeutic mindset. And so we are beyond just watching. We're not just cleaning somebody. We're not just providing personal care, but that's what we're doing when we're providing personal care. That is why it's so important. And those are the things you may not think about it, but those are the things that keep somebody from going back to the hospital. Number 5, coordination and communication. Whoa, that is so important in healthcare after discharge. Who's the point person when something goes wrong? Who should I call? Who's calling the doctor? Who's tracking symptoms? What you see, are you looking? Are you tracking those? This is part of what we do. You see, when someone say, well, hire this company to help with personal care, and all you think is, well, they can watch themselves for themselves. But those are all the things that we help someone achieve. And those are the kind of things, they simple, it's hard to see, but they keep somebody from declining, and they keep somebody at home, and they keep somebody healthier, and they keep someone from going back to the hospital. So the question is, who's calling the doctor? Who's tracking symptoms? Who's updating the family? Okay. And so as the company that is being run from a nursing perspective, we provide that kind of oversight and care coordination. We are the eyes and the ears in the home. That's what I see. We are the eyes and the ears in the home. We are communicating with everyone else outside, such as we're communicating with the physicians. We communicate with family members. I'll give you an example. I have a caregiver, I have a client that we have a uh, 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 we have a program that a monitor that we put in our patient's home called Sensi. And so with Sensi, it's programmed to help us coordinate the care in the home. It is programmed with specific care needs, such as falls, urinary tract infections, upper respiratory infections, and many other things that we monitor. Even when we're not home, since he's monitoring these things, even when we're not in the home, let's say you only have 4 hours of care. So we have Cincy in the home still tracking these kinds of things and giving us alert to them. So last week, I have a client that since he sent me an alert or something that I need to look over, it was this patient, I'm sensing some symptoms of urinary tract infection. So I immediately looked at it. I called the family. I said, no, I called the caregiver and I asked the caregiver to tell me about the quality of the urine for that patient. Does it smell? Is it strong? What color is it? Okay. And she said, oh, she told me. She made the assessment and she told me. And I called the family. I said, I'm suspecting that your mom could possibly have a urinary tract infection. Can we call the doctor? Can we get an order for a urine analysis? And she said, oh, sure. Well, we called, we got a urine analysis, and here she had a urinary tract infection. Immediately, we put her on antibiotics. She didn't have to get sicker. She didn't have to become septic, and she didn't have to end up in the hospital. We took care of it right there at home. And that's the difference that we can make when we can track symptoms, when we can track these kinds of things and help and get ahead of them before they get worse. And so we can discuss it with a provider. We spot those problems early before they become an emergency. So those are essential things, very important. They sound very simple, but very important. While we help with those kind of post-hospital situations, post-rehab situation, as a company, we also specialize in conditions where transitioning from home can be especially complex. So you have patients specifically that are dealing with Parkinson's disease. The medication timing is so critical. Movement patterns change throughout the day. Fall risk is very high. We understand the fluctuation and how to support families. And so that's one of the complex diagnoses that we focus on and that we specialize on. Number two, Alzheimer's and dementia. Coming home after hospitalization can trigger significant confusion, even in people who were previously stable. We know how to provide that calm, consistent support so they can be supported at home and be able to continue the healing process. Another complex disease is Lewy body dementia. This condition requires specialized understanding because symptoms can fluctuate dramatically. What works in the morning may not work in the afternoon. Another condition that I can think of is stroke recovery. Every stroke is different. Recovery is a journey, it's not an event. So we help bridge that gap between therapy sessions and in real life with that stroke patient. Complex chronic conditions such as heart failure, COPD, diabetes. When you are managing multiple conditions after hospitalization or after rehab, that requires vigilant attention. It requires that someone is watching, someone is monitoring, someone is tracking, because you're not dealing with just one thing. What if someone is coming home after surgery? You have wounds, you have pain management, preventing complication after surgery. These first few days and weeks after surgery, they are very critical. And so that is why we, as a company, we are continuous care, and it makes a difference. I call Gentle Shepherd Care Charlotte's only continuous care provider, because this is what I mean by that. Most home care agencies offer either medical care or companion care. You get a nurse who visits once a week, or you get an aide who help with bathing. They operate separately. You know what? We bridge that gap. And our caregivers not only train, but also they are supervised by a registered nurse, either by me, we have other nurses in the office. So all our caregivers are being trained and supervised by a registered nurse. They're not just helping your mom get dressed. They're not just helping your mom brushes her teeth. They are observing, and they are trained to observe. If is she more confused today than yesterday? Is that wound looking different? Is she bearing weight on that leg like she was yesterday? When they notice something, it doesn't get lost. It comes right to us in here as nurses, and we take action, whether that's adjusting the care plan, whether it's coordinating with the physician or alerting somebody who needs to know this is what prevents small problems becoming hospital readmissions. This is what we usually say about our company. A little targeted care can transform well-being. That's not just a tagline. This is what we see every day. And this is what we do. And so this is why I know families are often, are told they need 24-hour care or nothing at all. They either need 24-hour care, then that they don't need anything else. That's not true. See, even if we offer a flexible schedule, even if you were to have someone like us for 1 or 2 hours, it's perfect for helping with medication support and safety check, 1 to 2 hours a day. Perfect for medication for people with multiple medication, someone with complex diseases like Parkinson's, Alzheimer's, dementia, Lewy body. And they have a lot or a lot of chronic diseases. So the medication management is so important. So 1 to 2 hours a day. How about 3 to 4 hours time for personal care, meals, mobility support, and light housekeeping? For extended hours for those who really needed for substantial support. Okay. The other way you can see us in your home could be just for overnight care for families who need rest. Mom going back and forth to the bathroom all night long. Dad is getting up at night. They're not sleeping. They either have pain, confused, and you are awake not daytime and nighttime. And so that night support give you the opportunity to rest and so you can be available during the day to be able to do to support. We often start with more hours in the beginning after discharge, and then we taper down as your loved one regains strength and confidence. The goal is always independence for us, as much as possible, as long as possible. We want people to stay home. No place is like home. Everybody wants to be home. Nobody wants to be anywhere else. They don't want to be in the hospital. They don't want to be in rehab. They don't want to be assisted living. People want to be home. And that's what we're helping people to do. Couple questions that you can ask before you get discharged. If you have a loved one in the hospital right now or rehab right now, and here are some questions that you can ask before you get discharged. Number one, what should we watch for in the first 48 to 72 hours that would require us to call the doctor or take a trip to the emergency room? Write that down. Go ahead. Number two, can you walk me through the medication schedule? Ask them, which ones are new? Which ones change? And why did they change it? Number three, what is their risk for fall? What equipment do they need at home? Who is our point of contact if something doesn't seem right? What does their therapy schedule look like to discharge? Is home health coming? When? Are there any dietary restriction or fluid requirement we should know about? Okay. Here's one most people don't even think to ask. What did they look like on their best day when they are here? What did they look like? Ask the therapist. They know. What did they look like on their best day? This gives you a baseline to compare when you go home. Were they walking? Were they doing this? Were they doing that? And then you can compare that when you get home. Here's my message to you today. The transition home doesn't have to be terrifying. With the right support, even a few targeted hours a week, your loved one can regain strength, confidence, and they can feel well again in their own homes. That's what going home and staying home is all about. Not just surviving in the discharge, but thriving at home. Again, I'm Emma Soy, and this is what I devote my career. It is to honor our older adults and support families who love them through these sacred transitions. Now, you can ask questions. You can always email me. You can always reach out to us. If you have any questions going on in your mind, what situation you are facing, just reach out to us. There are no wrong questions. There are no stupid questions. Just ask us anything and we be able to help you with these. Questions that people usually have is, if Medicare is paying for home health, can we still use you? Can you, why do we need gentle shepherd care? Yes, home health and private duty care serve different purposes. Home health visits are typically brief and skilled. We are here for the daily support in between. How quickly can you start? We can often begin work 24 to 48 hours for discharges. We prefer to know that in advance so we can prepare, but we can start within 24 hours. How much does it cost? Providing generally what it depends on what the need is. So you just need to call us so we can do a consultation. My parent doesn't think they need help. Oh, this is so common. Parents can be very resistant, and it's often about fear or losing independence. Nobody wants someone to do something for them that they used to be able to do for themselves. And so the way we approach it is usually gradually with respect and often start with very small, safe, small amount of time. Uh, just a little bit of help with one thing here and there, and then you can increase later on as they build confidence, as they build trust. And so that it's all about that. Try us out. What if we try it and it doesn't work? We're flexible. If you try it doesn't work, then it's fine. Our care plan, can we evolve our care plan? We rather than adjust we rather have you adjust the plan than to have you feel stuck and have some money going back and forth to the emergency room. So call us. Thank you for being here today. Now, if you like to talk to me specifically about something specific, I offer free consultation. You can reach us at 704-209-5040 or send us an email, info@gentleshepherdcare.com, or check our website, www.gentleshepherdcare.com. And if you find this is helpful, we are here every Wednesday at noon. Share this with someone who might need it.